How's it going, guys? I just wanted to talk a little bit about exposure therapy. We talk a lot about it in mine and Noah's podcast, but I think it's an underutilized tool for people that works. I mean, and I would think a lot of it is tied in. Exposure therapy is tied in with behavioral techniques, behavioral therapy, but I think that we can look at it in a different way that goes along all aspects of life, I think. When you think about, when you're a baby, you're being exposed to different things, right? You're getting exposed to different types of food. You're getting exposed to different objects, feels. So we're starting to learn these concepts, learn these things around us. So when we talk about exposure therapy and how it deals with pain and how it deals with disease and anxiety, depression, and things like that, I think that we need to start having a conversation about how do we use exposure therapy and how do we make it so that it's controlled, so that it's not, I guess, overbearing for people. So I think that with pain, one of the things that FRC, functional range conditioning, talks about is preparing for that movement, right? If you listen to the podcast with Brad, we talk about isometrics as being a foundation of the foundation of movement, and then the dynamic exercise is the practice of movement. But if we don't have exposure to our vulnerabilities, right? That's the basic concept of exposure therapy, is we expose ourselves to our vulnerabilities, our weaknesses. So if we don't expose ourselves to, like for me, I've twisted my ankle so many times playing basketball. So if I don't ever expose my ankle to being in that position, then when I go play basketball and I step on someone's foot or my foot gets caught on the floor, I'm going to get injured, and I'll be out for however long. But if I expose my muscle tissue and I expose my joint to those ranges, then the next time it happens, it may not be as bad of an injury, or it may not be an injury at all. So just tying exposure therapy with pain. But I think in the future, I'm going to be talking about different aspects of how exposure therapy can be beneficial for people. I think a lot of people may be scared to expose themselves, right? Being vulnerable, one of them. But I think once you start to understand the concept that, you know, you're afraid of something, you are prone to getting sick more, or prone to get injured more, have chronic pain, things like that. Exposing yourself to something that can help with that, then it erases the problem. So that was a lot of different things to talk about. But I'm going to get it together and we're going to talk about exposure therapy. I just want to start the conversation. If you guys have any questions or comments, comment below. And I will see you guys later.